Welcome. Thanks for joining me. I'm Leigh Brunellen, the founder of the Natural Health Clinic, and in just a moment we're going to discuss the 5 warning signs of zinc deficiency. So please stay tuned. So zinc, we're hearing more and more about it in the news and other popular media resources, and it's becoming more and more important. People are questioning if they need to take zinc, if they may be deficient in zinc, and so today I'm going to give you 5 top signs that you may be deficient in that very vital mineral. So the first and most important one is that if every time during flu and cold season you're concerned about getting sick, because you frequently do, that is your number one warning that you are zinc deficient. Zinc is extremely important mineral for proper immune health, so if you find yourself getting ill frequently, if you find yourself dealing with allergies, either seasonal or yearly, those can definitely be signs of a zinc deficiency. If you find yourself having diarrhea or loose and unformed stools quite often, that is also another sure sign of a zinc deficiency. Maybe you suffer from Crohn's or colitis, or you just have digestive issues, but that is also another warning sign that you're zinc deficient. If you closely associate with that situation with the gut, if you have leaky gut, and if you're not familiar with leaky gut, what that is in the small intestine, you have what are called tight junctions. Because food is not totally metabolized and absorbed, sometimes those food particles can cause irritation, inflammation eventually, that wears these tight junctions down to the point that eventually the gut can become permeable, and at that point you can begin having other issues such as thyroid or skin, autoimmune. Really a plethora of other types of illnesses can occur from that leaky gut situation. And so if you have leaky gut, because zinc tends to be difficult to absorb, then it's most likely that you are zinc deficient. Also, if you have any skin problems such as acne, psoriasis, eczema, dermatitis, any of those types of things, then you are very likely zinc deficient as well. The reason is that zinc is, as I said earlier, extremely important for immune health. So your immune system not only obviously defends and protects your body, but it also repairs your body. And one of the important minerals in the repair of your body is zinc. So if you're having issues with your skin, obviously your immune system is compromised. It isn't repairing as it should, and that can be a sign of zinc deficiency. Let me make sure that everything is in working order this time, because last time, just a moment ago, I was having issues with audio, having audio technical difficulties, and I'm just wanting to make sure, using my trusty source, that everything's working. Yes, it appears as though it is. Super. If you do have any questions, go ahead and enter them now, and I will address them at the end of this presentation. As well, if I could get you to do me a favor, and that is to please like and share this video if you're finding the information helpful. That is now really one of the only ways that we can reach as many people as possible with this information, because of the censorship that is happening with these social media platforms. So another sign of zinc deficiency is if you are experiencing thinning hair or hair loss. Now, it kind of depends on your situation as far as this one. If you are, a 45-year-old male and every male in your family has had male pattern balding, then likely the reason you're losing hair is not because of a zinc deficiency. But, if you're a 25-year-old woman and you've had 2 pregnancies and you're nursing and you're losing your hair, then you're probably pulling it out because your kids are driving you crazy. No, that could be, in that case, that could be a zinc deficiency. So thinning hair and hair loss, depending on the situation, but it's commonly a reason, can be a warning sign of zinc deficiency. So who's at most risk? Who's at most risk for having a zinc deficiency? Well, the number one reason to have or generate a zinc deficiency is emotional stress. Now, I know that no one watching this video ever has emotional stress, so I'm sure this doesn't apply to you, but just, for entertainment purposes, let me consider this potential reason. So emotional stress, you pretty much just burn through. Remember I said repair, so you really wear the body down. That's why people feel exhausted and have such energy crises with a lot of emotional stress and trauma. But you wear the body down, and so therefore the more stress there is, the more tendency towards a zinc deficiency there is as well. So it could be a very stressful job, it could be a stressful family situation, it could be both, it could be just listening to the news, many different reasons for emotional stress, but that is a number one reason. I alluded to it earlier, but also a main reason for zinc deficiency is if you have had pregnancy, are pregnant, or are nursing, or have had nursed, within a few years. If it's 25 years ago, hopefully you've repleted your zinc, but actually not necessarily. So pregnancy and nursing, breastfeeding, those are pretty main reasons for having a zinc deficiency as well. If you are aging, so primarily women, but also secondarily men, the reason for women being primarily zinc deficient is because of what I said earlier as far as history of pregnancies and nursing. But just in general, if you're aging, as indicated by the digestive issues being a sign of zinc deficiency, zinc is more difficult, harder, challenging I guess is a better word, for your digestive system to properly metabolize and absorb so that it can utilize it. So what happens during the aging process is our digestive system naturally becomes less capable. And so you couple that with zinc being a little more challenging for the body anyway, we have a real potential of becoming zinc deficient as we age. And of course, since our immune systems are also becoming a little bit weaker as we age, that is not a good situation. So it's certainly important to consider zinc supplementation and the foods that I'll mention in just a moment to make sure that you have enough zinc in your system. So another person or type of individual who may be tending towards a zinc deficiency are those who exercise too much, which again, I'm sure everyone watching this are individuals who just train and exercise for hours a day, every single day, 7 days a week. But even if it was in the past, all joking aside, even if it was in the past that maybe through high school, college, whatever the case may be, you were an athlete and you trained regularly and hard, then you could still, to this day, be zinc deficient, especially if you have or had any of the warning signs that I mentioned earlier. So what foods can you consume in order to replace the zinc? The top one is pumpkin seeds. Pumpkin seeds are very high in zinc. Also, if you're male, pumpkin seeds, because of the same reason, being high in zinc, can be extremely helpful in prostate health. Oysters are another food that can help you to replace your zinc as well. Fermented foods are very important for two reasons. One is, of course, they help you to regenerate and heal your gut. So if leaky gut is a reason for zinc deficiency, then healing your gut can obviously help you to at least absorb it once you get into your diet. However, many of the fermented foods are also pretty high in zinc, so they can be very helpful in that way as well. Sprouted seeds and sprouted nuts can help you to replace zinc. They can be high in zinc. However, if you're having gut issues, I do recommend that you're a little bit careful, especially with the sprouted nuts. Make sure that they are sprouted seeds and or nuts. So those are not the common seeds and nuts that you can go to the local store and just grab them off the shelf and eat. They have to be sprouted, otherwise they are not going to have the zinc content in them that is necessary in order to help your immunity. So as far as immunity is concerned, one of the main things that zinc can be helpful in is for the blocking of the replication of RNA-based viruses. And the reason is that once the zinc is in the cell and that viral pathogen tries to penetrate the cell and get that DNA in order to replicate itself, to become virulent, so to speak, the zinc stops that process. It can just completely prevent that process from continuing, and so for all intents and purposes, you don't have this viral issue. So zinc can be extremely helpful in different kinds of infections. So it's very good to make sure that you have adequate levels of zinc in your body. Now in the office, we actually do what is called a zinc test, and it's using a solution, a special solution. You hold it in your mouth for about 30 to 60 seconds. And depending on if you taste something or don't taste something, that definitively tells us if you are zinc deficient or not. And don't worry about the test. You know, we only test it on every other person as far as COVID's safe, and the bottle wears a mask at all times, so it's perfectly safe. Don't worry. Of course, I'm just jesting. So anyway, that is one way that we can test for sure if you are sufficient in your amount of zinc in your body or not. We'll know within 30 to 60 seconds. So let me look one more time to see if there's any questions before I conclude the presentation. In the meantime, as I'm looking for the questions, if you would like this video, share it with your friends and family. It's really a favor to get this information out to others. We do need your help in that. So let me take a look here. Let's see if I can figure out how to work my phone. Okay, well, it doesn't seem to... Having all kinds of technical difficulties today. Okay. Okay, well, I am not noticing any comments. If you are watching this video at a later time, feel free to ask any questions and I will address them as I become notified. And again, if you would please like the video, share it if you found the information helpful. Now, before I conclude, one of the problems, as I mentioned earlier, with zinc is that it can be more difficult for your body to absorb it. So what I use in the clinic, it's a special form of zinc. It's called zinc liver chelate. And what that means is that it's a form of zinc that has been pre-digested or pre-metabolized by a liver. Not a human liver, so don't worry, it's actually by a bovine liver. But the point is that the mineral has already been processed, so to speak, metabolized. So therefore, when you take that pre-digested form, it's much, much easier for your body to utilize it and absorb it, especially if you're having a tendency towards aging or digestive issues. So that's what we tend to use in the office. It is a very good form of zinc. Also, when you're taking zinc, you need to make sure that once you get above 100 milligrams, 150 milligrams, be careful because zinc can be difficult on your kidneys and you don't want to have any issues there. So just do be aware of the fact that zinc can be more difficult on kidneys and you do not want to get too high or too prolonged of a level, high dose of zinc. So again, I really hope you found this information helpful. If you did, please like and share. I really appreciate that. And I'll see you next time. Thank you very much for watching.